is Delphina, and then I have here with me the president of the Viola Fletcher Foundation. The president's name is Mr. Ike Howard, and then I have the operations director as Rev.Tony White. Today we are here to talk about the foundation and then what inspires them to build up this kind of foundation, and then why they made Ghana a hub. So how is Ghana treating you so far?
Absolutely wonderful. The people here are absolutely great. Thank you for asking.
What about you, Mr. Tony?
Wonderful.
The Viola Fletcher Foundation has been doing a great job so far with what I have seen, kind of donations you do. It's just amazing. It's so amazing. But then I want to know your goal. When you talk about the digital healthcare, I want to know your goals towards it.
Well, the primary goal is population health for the entire globe. For 70 billion people, we want to concentrate on population health. Like you said, we chose Ghana as the hub for this goal. So we're really here to focus on population health. Imagine a digital health network system, right? A single advanced integrated digital platform for secure collection, mapping and management of all global healthcare data. A clinically focused, device-independent, next-gen electronic healthcare medical system that's more than just front-end legacy billing. We want to ensure all data is analytics ready, regulatory ready, secure, private, and accessible by all stakeholders, i.e. the patient, the doctor, the x-ray technician, anybody that will have use for specific data. We want to give you the specific data that you need. We want to democratize data, access to underserved and underprivileged populations. We want to offer standardized software, services, and tools to ease manipulation and analysis of global healthcare data. And we want to do this primarily for the underserved. So this is something we want to give to the world to change healthcare as we know it. The DHN, the Digital Health Network, will together tie all participants in the delivery of supportive healthcare workflows, including patients, physicians in the field, physician officers, i.e. doctors, specialists, eye doctors, orthopedics, heart surgeons, clinics, hospitals, medical and testing labs, the Ministry of Health, imaging centers, and lastly the payers or the patients, so to speak, the end goal users. This will change healthcare as we know it today, and this is our primary overall goal.
Limited to Ghana, how do you plan on making a dream come true for the less privileged?
Well, first of all, we have a bottom-up, top-down approach. So I really like interacting with the people of Ghana. I have a great director, Tony, and he is well versed with different areas of Accra, Ghana, whether it's central region, northern region, or the immediate area. So we reach out. We've had a health screening recently, and what we did is we reached out to the people, and some of these people probably have never had medical attention at all. And we tested for HIV, we tested for malaria, we gave out medications, we gave out hepatitis B shots, and it was a tremendous success. People were they were crying when we arrived, and they were crying when we left. And it's a really moving situation. We started a very popular project called the PADME Project. This idea originated all the way from the United States. A good friend of mine named Kristen that works for Demosophy, and also Lady Liberty. She is the queen of Berea. And so good minds, good people think alike. We understand that a young woman's self-esteem is very, very important. And then when you live in poor conditions, or you have less than others, or you're underprivileged, you may not have the same resources as some of your counterparts. We want to step in and help, because we know given an opportunity to buy deodorant or to buy food, you're going to choose food every time. Hunger always wins. So if we can step in and give some of those things that should be everyday items to people who can't afford them, then that's a blessing. My staff teaches the young women about menstrual health, the importance of the menstrual cycle, and not to be stigmatized or isolated because you're on your menstrual cycle. We want you to be a strong, confident young woman. We don't want you missing any school days because you're on your menstrues, as they say here. So we gave out 2 bras. We gave out 7 pair of panties, 1 pair of panties for every day of the week. You change daily, shower daily. We gave out deodorant, and we gave out menstrual pads. So there are a lot of people who understand the need for this, and we are seeking partnerships in everything we do here at the Viola Fletcher Foundation. Of course, I have my primary and main partners, Intermittent Solutions, Palladium LLC, and the Mosby back in the U.S., but we really need worldwide partnership to keep doing the great work that we want to do. We want to change the world as we know it for the better.
Like, it's so amazing. Like, I'm so overwhelmed with the kind of donation you just mentioned you did for people. Coming to you, Mr. Tony, you being the Director of Operations, have you enrolled any governmental support from any of the leaders, any stakeholder?
Well, number one, we've not had any rejections. The support starts from when the government allows you to operate. The government of Ghana has given us all the tools to operate. We're a registered NGO, both with the GRA, the Registrar Department, and we also have a not-for-profit certificate. And you know, this certificate is not gotten by every NGO. You have to, there has to be a due diligence before you get this, and we've gotten this. A few days ago, we were invited by the mayor of Accra, the first female mayor in 124 years, Honorable Nasaki, who gave us verbally all the supports that we need. And it was on the premise of this that my president has been able to raise some funds to build a public toilet in a school under her jurisdiction. So for us, this is an attestation of and support for the work we do. Of course, the educational directorate around Teshi also allowed us to help the young girls in that vicinity. I also like to let you know that the very first time Mr. Howard came to Ghana, the very second time, he was well received in the central region, and that was where this generosity started, because he brought computers for a school that has had a computer that is maybe over 20 years old. So what I try to say is the traditional authority, the traditional system, the governmental system accepts what we do, because if they do not, they know we exist here. The first thing we did that the president directed that we do when we started operation was to write to GRA to say, listen, this is where we are located and this is what we do. And we officially wrote to them, and they said, you guys carry on your activities. If we feel like we'll visit you. So in a nutshell, yes, the government is in support of what we do, and I'm sure that when we call on them, they will assist us. And then finally, when Mr. Howard came here, we also went to visit the Deputy Minister for Water and Sanitation. And, you know, he graciously received us and told us verbally also that he is available to support us anytime we come to him for support. So I think they are in support of what we do and what we are about to do and what we will continue to do by the grace of God.
With this donations, and then how has your journey been so far? How has it been so far? Is it impressive? Do you have any challenges?
I think you should ask my president, because
there's protocols and different things that go on in Africa, and sometimes it can be difficult to help people. And you know, I'm really here in good faith, and I really want to help people. That's why I hired local Ghanaian people that speak different dialects. When we pass out items to the young girls, we have a question and answer period. My staff members speak Ga, they speak Tree, they speak other languages. So I speak it in English, they repeat it in English, and they also repeat it in other dialects. to make sure that we can answer all the young ladies' questions.
To understand what you're
Right,
saying.
to understand what we're saying. So, like I said, the primary goal is population health, but we also do things that we know all the communities need, because there's a great need in many different areas. That's why we're here requesting that we have worldwide participation, requesting that we have churches get involved. We'd like to partner with churches, local government, city officials, the Ministry of Health, Ministry of Water, anybody that would love to partner with us, because we show results. We show absolute results. If you go to the website, the Viola4FletcherFoundation.org, and look on latest news, you'll see the videos of us doing the PADME project, the first PADME project, the community outreach, the second PADME project, and the PADME project is ginormous. The girls love it. The reception that we're getting from the people in the community is outstanding. Reason being, there are a few other NGOs that I've heard of giving out pads, but we're one of the NGOs that take it a step further. We're giving out deodorant, we're giving out bras, and we're giving out panties, and we're giving out training on how to use these things properly, why it's important, and we have physicians and people to back us up. We partner with Miss Earth Ghana, who's the foundation is very green. We're about clean water, clean environment, removing the plastics from the beaches, protecting the ozone layer. All the things that she represents, we also represent. So it made for a good partnership. So in some of those videos, you'll see Miss Earth Ghana participating and teaching the girls about their menstruation cycle and why it's important to properly dispose of these items. We try to think of all aspects. We don't do anything kind of half-tilted. We try to think things through, come up with a plan, and execute that plan. If you look at those videos on the website, you will see the action that we take, how far we take it. All the bags we made ourselves. Everything we went out and procured, all the items, we put all the items together. I have a volunteer workforce as well. I put an advertisement out on Instagram and Facebook here in Africa, and within hours I had 50 or so volunteers. I have volunteers as we speak waiting for me right now in the lobby to speak to us about volunteering for the foundation, because they believe in the vision. They have parents that need to see the doctor. They have young girls in school. They want to do internships for us. They want to volunteer for us. So we're well received in the community, and I love it. I just need more resources, whether it's pads, deodorant, black soap, toothpaste, toothbrush. Because the next bags that we give out, we want to include toothpaste and toothbrush. That was a good idea. That was brought up by Rev.Tony. I love this work. I love doing it. I just need all the help that I can get, because we really want to make a difference.
Do you have any last words to tell the people watching you out there?
I would say, please go to the U.S. website, go to the Ghanaian website. Please call us here at Africa Works. We're in Stanbic Heights. Reach out to Rev.Tony, reach out to Abigail, any one of my staff members. Come give us a visit. Come here and give us a visit, see for yourself. Please volunteer. We ask the volunteers. If you can help in any way, fashion, we greatly appreciate it. We want to change the healthcare system as we know it. Physical health, mental health, and we need data to do that. So please help us to help you. Help me to help you is what I would like to say to anybody watching. And anybody that would like to give us a helping hand, we greatly appreciate it. And God bless.